can you talk
Yeah,
to me about yourself?
sure. So I've been a nurse since 1988, and I did a variety of hospital jobs first. Most recently, I still work per diem in post anesthesia care unit. So I've been doing that for the last 18 or so years. I did ICU. I did the educator role in the hospital for about 10 years. So at this point, I've been teaching in academia for 19 years, and I stayed per diem at the hospital at the same time. I do clinicals at the hospital in addition to adult health. I've done adult health 1, 2, and 3. I'm in charge of the 3, the critical care part of it. And then I do a couple electives in our school, a faith-based nursing elective that I developed. So it's talking about instead of nursing as a job, it's how you incorporate spirituality into your care of patients. So I have that elective. I
You
also,
created that
yeah,
course yourself?
I
Okay.
created that course. Yeah,
Okay.
I created that course. There's no comparable course that I was able to find at other universities. And there was a textbook. One of my old professors wrote it, but it's out of print. So I kind of just made it up myself. And then I also made up a elective that I take a student with me to a camp that I volunteer at. It's a Christian camp, and I volunteer as the camp nurse for the week. And there's campers there that are intellectually impaired, anywhere from age 18 all the way up into the 70s. So we give meds, lots of meds: breakfast, lunch, dinner, bedtime, and first aid. So I bring a student
to
to that.
volunteer. That's a
Yeah.
great initiative.
Yeah, it's fun. It's really fun. And then, the reason that we connected was because I developed another nursing elective. We call it cultural immersion. And I had been involved with this organization before I came to Neumann. I had taught at another university, and I had gone myself a couple times and realized it would be great to take students. So in 2017, I started it. Originally, it was a clinical option for community health because I was teaching that at the time. But after COVID, we made it into an elective. So I've taken 10 trips now to Dominican Republic with over 100 students. And I've also done my own team. So I've kind of put together nurses, PAs, NPs, pharmacists, and then the students themselves, recruiting the students at the university. So they have a couple classes before we go on the trip. We go on the trip for a week, and then they have some responsibilities to earn their grade, which they have to present to the university about the trip. They have to go to open houses to represent nursing and talk about, recruitment, because it's an unusual, option to go to nursing school and get this option to go on a mission trip. And of course, they have to write journals and papers and things like that too.
So you are just looking for you just look for any opportunity that they can get more experience for your students.
Yeah, so it's worked out really well because I started going to this organization in Dominican Republic called Solid Rock International, and that's where I still work. I work with them every time I take a team, and they're used to hosting teams, so they have it very organized. They pick us up at the airport, take us to a hotel. We stay there overnight. We get up in the morning and then travel by bus 3 hours inland to where the Christian clinic is. Ugh, if I could talk. It's in San Juan de la Maguana. It's called Christiana Clinic. It's Solid Rock International. So they take us there, we prep, and then we spend 4 days out in the neighborhoods and the barrios doing medical clinics. So we'll set up at a school, we'll set up at a church, whatever the community's biggest area to set up at. And then we will run stations. We'll have a triage station where the people get their vitals taken, possibly weights, blood sugars, the history, the meds, so that the students can do that station very well and get to practice their vital signs with the regular old blood pressure cuff again. And then the patient moves to the providers, and they sit with the providers, and the chart's about half a piece of paper or third of a piece of paper, and the providers will do their assessment, and the students can also sit with the providers. So it's cool because we have a PA sometimes who comes with me. We have a nurse practitioner who does speak Spanish, who will be coming this time, and then we always hire a Dominican doctor, which is a great resource for us because the medications, the dosages, things like that might be tricky. So it's good to have him there. And after the patient sees the provider, then they take their slip to pharmacy. And our pharmacy is this big wooden box with all the meds in the little cubby holes that the students have counted ahead of time. So you count for 30 days and label and all that. And then they look at the slip, they put it in a paper bag, fill the prescriptions, put it in a paper bag, and then the pharmacist checks that. And then a Dominican will then give instructions to the patients, and then they can go off and, leave for the next time the clinic is. Because these neighborhoods we go to, we rotate around, so they're pretty rural. We might travel from Solid Rock for like a half an hour to an hour or more sometimes. Okay. And then the students also get a chance to go out and visit patients in their homes with our pastor, and he will do some preaching out there. And then they also can take blood pressures or assess patients, and if there's a need, then the doctor would come up and see those folk because they might be older, can't get to the school as well, or just not just sick or whatever. So
you guys work with local nurses in those areas?
No, it's Solid Rock, so they have these teams come.
Okay.
Spring and fall. Summer's very hot, so they usually just do Bible studies and things like that, and training for teachers. But they have 5 schools in that Dominican area that we sponsor students to attend. I sponsor one, and we'll go visit her and bring her some goodies and things.
Some students, nursing students, or just students, regular students.
It could be anybody. Sponsored an elementary school student, so I can keep sponsoring her every year until she ages out of the school system.
Okay. Oh, that's good.
Yeah, and they have schools. They do have like a nursing school, which is a classroom, and it's more like an LPN level of training.
Okay.
They have computer science and something else. So they talk a lot about education for the people to help themselves, right? Yeah. Education is the key to get out of poverty. So they talk about that, and they do a nice job of giving us other things, experiences like being in the town and eating the food and
experiencing a different environment. What was the learning over time from these missions?
How I learned over time?
Yeah.
Well, luckily,
yeah.
Luckily, I went myself a few times, and that helped me get comfortable in the environment and how they do things. And then I was with my friend who was the team leader, and then eventually I took over as team leader. So I had her to ask questions too. And they're very good about sending information and keeping the team leaders. They have manuals that we can look at, and there's a connection there at Solid Rock that we can talk to if we have any issues. So over time, just practicing. It's always a different group of students. So hopefully, everybody has some rules. They have to behave, right? While they're with me, represent the school well. And I really like to think that they're coming for the reason that they want to help people and they want to experience a different culture. Yeah. And I hope that it helps them, just be a little bit more open when they're taking care of patients that look different from themselves at the hospital, because they can pull that experience and realize, maybe they're coming from, these patients are coming from a different country with a different healthcare system, and they're scared and they don't know how things work, and why it's important to get translators, even if you know a little bit of that language.
And what have you found challenging in the process?
You know, it's really just being on that whole week, right? Being available for students and the other people that are going with me. I've had the luck of having some people go several times who are comfortable, but there's always some newer people that come, so they're anxious and have a lot of questions too. So it's always that I'm available 24/7 if there's any problems or questions, or we sleep in it's like a dorm kind of building, so I'm there all the time if there's any problems. I've had a couple little student issues in. I won't take a couple anymore. I won't take two people who are dating because they were off to themselves. They didn't talk to anybody else, because it's a Christian organization. So I have to watch that in the hotel. There's access to alcohol. So we have to talk about responsibilities, and not that you can't have a drink, but let's be safe about it.
Yeah. So what was your story with nursing? What brought you into nursing?
Way back when. Way back when.
Yeah.
It's funny. My mom is a nurse. And at first I didn't really want to do nursing, and I love to read. So I thought, I may do something like English or library science or something. And then I started working at a nursing home, and it happened to be a nursing home for nuns. And they took such good care of the sisters. So I just sort of then, I decided to go to school for nursing. So it's been, I don't know how you feel, but I think it's a wonderful career. There's so many different things that you can do.
Yes.
I also do some legal nurse consulting, which is interesting. I've written articles, did some research. There's so many avenues in which to go.
Yeah, I like nursing because of that. There's a lot of things that you can learn. So how do you keep organized? How are you able to prioritize things despite all of those things that you take
that I'm doing?
Yeah,
yes.
That you take care of.
Yeah, it's a little bit easier because typically in the summer I would only teach one class and just work at the hospital per diem. But so it's a little bit better. When I've done a trip in the spring, it can be very difficult because of the time lapse is shorter. Just keeping up with the emails. I'm trying to let the students know more ahead of time, because once they are done the semester in the spring, they really don't go and look at their emails again. And then I'm struggling to communicate. So I told them they have to look at their emails all summer. So it's just over time I've tried to be more organized. I also decided to do an Amazon wish list because we have to collect over-the-counter meds to bring with us, and dressing supplies and other donations, things for the kids that we can play with while we're there. So I have an Amazon wish list to share with students and their families, and I have everything shipped to my home, and then we have a packing party. I load my car up, bring it all to campus, and then we pack it in the suitcases. So it's just having the time to keep up, what do I have to do next?
That's great. I didn't know that Amazon had that, like, where people can donate things.
It's cool. Yeah, because I have a list of all the different things that I need, like hand sanitizer, meds, whatever, and how many that I want. So I've picked them out myself.
Okay.
So I try to pick the best price, or I'm thinking nobody wants to spend probably $30 on a donation, but they might do 10. So I'll pick out smaller amounts of things too, and then once they choose it, it automatically ships to me.
Oh, okay.
That's so good. They don't have to do anything but go to the link that I send.
And okay, cool.
So that's been huge. That was my daughter who helped me with that one.
Okay, cool. How do you keep motivated? How are you able to sustain?
It can be tiring for sure, and a lot of behind the scenes work that people don't know that I'm doing, right? To get all this up and running. I have some support from the university in that they have the students apply, send their passport. We get travel insurance through the university. The university supports us financially. The students now just have to pay $1,200, and it's included in their tuition. So it's not as much of a burden as previously when I had to collect money up front. So that's much improved. But I think to stay motivated, it's just such a great opportunity to show students. My own daughter went with me twice, and I just think it was so eye-opening, so to see a different culture, to realize how rich we are in the United States. Even the most poorest person has access to services. To see how people live in another country, and they come back. I just love it when they come back and they say, this was this best experience. I'm going to
We
remember
get
it for the
used to
rest of
what
my
we
life.
have. That's the thing. We
Yes,
need
yes.
something new. You need something
Right.
new every time.
They're like, I get to take a hot shower when I get home, and I get to use toilet paper. Yes, you do. Yes, you do. But yeah, I really feel like they feel like they're transformed. They feel appreciative of their lives. And, a fair number of students really have that spiritual part of themselves, and they get to talk to the people and see how happy they are with what they have, how close to God they are. They can pray with the people if they like. The pastor doesn't force anybody, but they can have that experience. And I think that helps motivate me, right? Because I'm able to facilitate it. I did say, like, how many years can I handle doing this, right? Like,
I think it's something that you like, so that and you organize it, most of it all on your own. It's not the school that is organizing it, and
no, only what I just told you the university does. Otherwise, it's me. Occasionally I've had another faculty go, but their role is more as a chaperone. I still all do all the prep and stuff. I have 17 students for this October trip that's coming up. And I have about 7 other staff members. I'm low on providers because like we said, we hire the Dominican doctor, but if I have a lot of students seeing patients, then they filter to only like 1 or 2 providers. It slows things up. So that's my goal, that I can find another provider or 2 to go. I had somebody back out, but this happens.
If there is one thing that you have learned in your professional journey that now guides your work and overall well-being, what is that?
I think when I talk to students, especially those who have struggled, have personal issues, or have not been successful in nursing course and have to repeat it, or they've been dismissed and are readmitted, I always tell them that all of us in life, we've struggled, right? We've struggled with things. I didn't get straight A's in college. I got that C in micro. I failed things in my life too. And you have to just pick yourself up and keep going. And, I guess sometimes they perceive, especially somebody with a PhD, that, they're so smart. And I say, I'm not. I just worked hard and really wanted to do this. So that's the secret, right? You could do anything you put your mind to, almost. And I just want to personalize it and be supportive to students, and because I've gone through it. And it's probably the same for you. Like, I was in school and had kids and worked full time and got it all done. And how did I do that? So I try to share things that I've done to get through. Just to put me, I don't want myself to be a peer. I'm there to help the students.
That you have been through
sometimes it's
similar struggles, but you were able to find solutions to it. And
Correct.
Do you engage in art or in any artistic activities by any chance?
I'm not very artistic, but I do like needlework. I love to read. We just bought a house. Well, it's 5 years ago. We bought a house here in near Cape May. So walked to the beach with the dog, and I was just out there painting the fence. So physical labor sometimes is good for me.
Yes, that's something meditative. Yes. It has the same effect where you don't get to think of anything. You just
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 painting,
painting the
just
door.
pulling weeds,
Yes.
whatever. Yeah,
Yeah.
doing mowing the lawn, whatever. Yeah, I think that we use our brains so much. It's a good break for me. So
That's
yeah.
good. I appreciate it that you took this time, and I hope we get the opportunity to
Okay.
meet again.
Yes.
Yeah,
Okay.
yeah, yeah.
And I would love to maybe have some of my students talk to you about their experience when they come
Yes.
back, if you would like.
Yeah, absolutely. I'm looking forward to it. Yeah. Thank
Okay.
you.
Wonderful to talk to you.